then we'll jump in.
Thank you, Anna. Yes, welcome. And this is my first Children's Cabinet meeting. So as acting commissioner, which I'm very excited about. So we've got a few presentations today about really good work and cross-office collaboration, cross-department collaboration. So I'm very excited to hear about it and to have you ask questions, and I'll kick it back to Anna.
Great, thanks. I just wanted to give a couple of updates about some exciting work that the Children's Cabinet staff are involved in, and many of you, I think, are aware of some of this work. First off, I just wanted to let folks know that a cross-agency team that includes staff from DOC, DOE, DOL, and both Maine CDC and OBH at DHHS, as well as myself, have been chosen to participate in a technical assistance opportunity with the Forum for Youth Investment. The title of the initiative is called Building Ecosystems Statewide for Thriving Youth Initiatives. So these are all teams who are focused on youth policy and programming. And this initiative will support us to actually also engage, not only work cross-agency around developing a new programming for youth. Specifically, we are looking at mentoring of having young people the ages of 18 to 24 who are also themselves really a little lost, maybe disconnected from school and from community-based organizations, to figure out a way to engage those young people to serve as, and to provide the training to serve really as mentors for middle school and high school students. That is what we're initially thinking in terms of a program, but we think that it'll evolve over time as we get technical assistance from the Forum for Youth Investment and their experts, as well as the really most interesting piece of this work is really that it's the Forum for Youth Investment will provide funding to engage young people as well as a parent, all with people with lived experience. So we'll be working with 3 young people who represent different systems within the state. One young person who has been part or touched by the juvenile justice system, another young person who's in foster care, and then a third young person who is a young person with a disability who has participated in the Young People's Caucus. And so we're really excited about this work. We are going to be flying to DC for the launch of this initiative at the end of the month, where we'll meet our experts who will be helping us with our programming and planning. It will be a kind of the Forum for Youth Investment is really saying they're the neutral convener, but they're also providing those supports and expertise to help us with our planning. We will be part of a peer learning cohort as well that includes Colorado, Indiana, and Connecticut. So it'll be nice to be able to be with other state partners to learn from all of them. So that's the Forum for Youth Investment work. Happy to share out more information as we participate in this effort. And then we also just wanted to give an update on the work that's happening around the preschool development grant. Just quickly, we have over the last week engaged in 2 early childhood education summits. Our first summit was last Thursday in Portland, and we brought together teams from across the state that included representatives from so the teams were local teams. So they were regional teams of folks, mostly from specific school administrative units. So a lot of them around small towns that were part of a school administrative unit, so a local school district, and brought together representatives from the early childhood education system within that community, from childcare, Head Start, other programming for young children, both home-based and center-based childcare, as well as representatives from early elementary years, and brought those teams together to learn together around evidence-based and best practices around play and social emotional learning, as well as giving time for those teams to really get to know each other, build those relationships, and really do planning together. All of the teams received mini grants that they will use of $800 that they will use to help support their work, with a real focus on those transitions for children and families from the early care and education system into school. So usually, that transition into pre-K or kindergarten. And I will say that there was a strong focus as well on our child development system and the kind of those changes that are happening that Megan Welter spoke about at our last meeting of the transition of responsibility for special education services for 3 and 4-year-olds from our child developmental services into our schools, and really the impact on our early care and education system and what that's going to look like and what are opportunities for partnership. So great conversations were had, big relationships built, and we will continue to provide technical assistance to those teams as they build out their work. And then just lastly, we have a room full of about 100 folks over in the room next to us, of folks from teams from Off-Child Family Services, and that includes child care licensing, as well as their partner of Maine Roads to Quality, and then the bigger team at OCFS, folks from Maine CDC, and folks from the early learning team, and really doing that cross-agency of building relationships, identifying opportunities to work together. We've already had some really great conversations at our tables. So excited about today and the rest of the day, and that all is being funded as well through the Preschool Development Grant. So that was a lot. Any questions?
So Anna, not a question, just a comment. And this is specifically about the first grant proposal. First of all, this is very, very exciting. And, you know, sometimes when the Department of Labor is here, it's like, okay, and we're talking about children, how do all these pieces fit together? I mean, that grant proposal is absolutely critical to supporting some of the efforts that we've been engaged in for a long time. And I just want to acknowledge the importance of that partnership and how excited we are about it. One of the questions that I frequently get from the governor, and you've probably heard it too, is about workforce participation rates. It's like, who's not in the workforce now? Where are they? What are we doing? And we've really been focused on trying to make sure that people with disabilities see a place for themselves in the economy early on, and that we're leaning into aspirations. And this is one of the important pathways. So I'm looking forward to what we're going to be learning here. And I know Libby Stone Sterling is our representative on this and is keeping me up to date on this grant, as well as some other things. So I just wanted to say thank you. This is very, very exciting, and linking education, corrections, DHHS, Department of Labor, that's the work that we're really committed to and appreciate the partnership. So thank you.
That's great. And I will say that I think all of us being in rooms together will force us to think about how all these pieces fit together even more. I think there's a lot of great coordination happening and collaboration, but this will bring us together and building those relationships and thinking about, okay, where are the gaps? How do we ensure that we're in particular serving young people with disabilities? And I will say there's a lot, Libby and her team are just working on a tremendous amount of work, and we're starting to really connect with Christine Thibault over at DOC and others to really starting to make those connections of how do we work together to support those young people, and then bringing in the folks from, you know, Sheila from Maine CDC, as well as we are just quickly, won't go on much longer about this, but we're bringing in Alice Preble from Children's Behavioral Health Services to help with this Forum for Youth Investment work. She has not been engaged in Children's Cabinet work, yet she is doing a tremendous work around peer mentoring and peer supports. So excited about really expanding the team as well, and building up those relationships even more deeply. So speaking of deep relationships and tremendous work that's happening, I'm going to turn it over to Mariette, who's going to talk about the Child Safety and Family Wellbeing Plan. She's also Melissa Hackett from the Maine Children's Alliance is also here. She's been integral in this work and this partnership. So Mariette, take it away.
Thanks, Anna. Good morning, commissioners. Good morning, everyone. Oh, Anna, could you give me permission to share? You may have figured it out, but Anna and I are sitting next to each other. So that's why my box is turning green when Anna is speaking, but we're trying to avoid the chaos of speaker feedback. Can you all see my screen? Okay, great. Well, good morning, everyone. And as Anna said, my name is Mariette Aborn. I am the Special Projects Manager for Child and Family Wellbeing in the Commissioner's Office at DHHS. And I'm joined today by Melissa Hackett. Melissa, do you want to introduce yourself?
Thanks, Mariette. Hi, everyone. Really pleased to be here with you all today. My name is Melissa Hackett. I use she, her pronouns. And as Anna said, I am a policy associate with the Maine Children's Alliance, and in that capacity, serve as the coordinator and backbone support for the Maine Child Welfare Action Network.
Thanks, Melissa. And MCWAN and the department have been partners on the Child Safety and Family Wellbeing Plan that we last presented to this audience about in July of last year. But today we're here to provide an update on one of the initiatives called for in that plan, and that is a parent and caregiver campaign to normalize challenges and promote help seeking. This work has involved coordination with many departments as well as communities, so really grateful for the opportunity to share it with you all exactly 1 week in advance of its formal launch to parents and caregivers across the state. And so we welcome any feedback or recommendations through our presentation about how we can raise awareness of this message, as well as the new resource through the BeThereForMe.org website that is coming soon. With that, I will turn it over to Melissa.
Thanks, Mariette. So I'm just going to really do some level setting and context setting, talk a little bit about what Be There For Me is, where it came from, what our hopes and dreams are with this project, and could not be more excited to be here with you all today, 1 week away from our public launch, to really talk about the good process and relationship work that's gone into the development of this campaign. And that really leads us into our opening. It's much more than a campaign and website. Be There For Me is a message that we believe all parents and caregivers in Maine and the people who support them really need to hear. So really looking at those two audiences, right, that this is really directed at parents and caregivers, and really focusing on this idea of the importance of taking care of yourself and your children, and recognizing that that's hard and that everyone needs help sometimes. So Be There For Me is a judgment-free place for people to start to find support. And then for everyone else, Be There For Me is really a call to support parents and caregivers without judgment in the various roles that we take up in community. So where did Be There For Me come from? This is an initiative of the Child Safety and Family Wellbeing Plan. That plan, as a reminder, establishes a strategic framework to keep children safe by keeping families strong. In the engagement sessions were substantial that led to the development of that plan, parents, caregivers, and community partners shared that it was difficult to figure out who to call and who to reach out to for help, and that parents and caregivers experienced a significant amount of fear and stigma in terms of reaching out for support when they needed it. And so this really led to a recognition that we needed to normalize those challenges and really reflect back to parents and caregivers that it's okay to need help. In the 131st legislature, there was a $750,000 allocation of one-time funding to develop this campaign and resource website to increase the awareness of the existing resources and supports available to parents and caregivers, and to normalize that parenting is hard and seeking help is a strength. So really feel like it's important to talk about our process in terms of the development of this campaign. This is really a deep, strong partnership between DHHS and MCWAN. And we also really deeply engage with a diverse group of parents and caregivers. The website and the messaging campaign were really created based on what parents and caregivers said they need and how they talk about their lives. And you'll see that as Mariette goes through some of the content. For example, we don't talk about substance use disorder as a website resource. We name drugs and alcohol because that's what parents and caregivers said is the language that they use to talk about that. So we really tried to embed that and reflect that back to parents and caregivers across the website and across the messaging campaign, using language and talking about challenges the way parents and caregivers encouraged us to think about those things. So this campaign and website were really deeply informed by a variety of activities. We held several focus groups with parents and caregivers and BIPOC community leaders to get their feedback and understanding about the challenges and to really think about how to talk about these issues. We also had a variety of community engagement sessions, both with state and community and partners to inform this project. There's also an ongoing community partner work group that the network supports to inform regular input and feedback in the development of the Child Safety and Family Wellbeing Plan, including this initiative. And then, of course, state partners like you all really looking across agencies and departments to think about the many folks who are working to support parents and caregivers and making sure that we're all really thinking together and doing this work. So again, just sort of reflecting back to you all some of the high level messages that we heard from parents and caregivers about what they said they wanted Be There For Me to do. Really, we just heard this strong message in the community engagement sessions leading up to the plan that parents felt very alone. They felt very isolated in their challenging role as a parent and caregiver, and also as people, and the need to really recognize that parents and caregivers have a very challenging role as being parents and caregivers, and they're also people that might have different challenges and need support in different ways. We also heard from parents and caregivers that they really want to have a community that they feel supported by and not judged by. They wanted this messaging campaign and website to speak directly to them as parents and caregivers, rather than sort of being focused on providers and folks who are supporting families with the words that they use to talk about their own lives. We heard very strongly from parents and caregivers that they did not want another directory of resources. They wanted to know how to get started to find support with the fewest clicks, fewest obstacles to sort of navigate finding those first layers of support that were available to them. And finally, we feel like it's important to sort of differentiate. We know that there are a lot of resources and websites out there for parents and caregivers and particular issues that might also be reflected on this website and campaign. Again, there's an emphasis that the audience is directly to parents and caregivers. It's not directed toward community providers in terms of the language that we're using and the way that we set up the navigation. It also includes resources for parents and caregivers of children up to age 18, recognizing that there are some websites that are focused on specific age groups or specific needs of children. This is really for parents and caregivers of children up to age 18. It again emphasizes the role and support for parents and caregivers that is independent of their caregiving roles. So while there are a lot of resources that talk about their role as parents and caregivers and support in that particular role, we also really heard that it needs to talk about what kind of support people need as individuals in addition to their role as a parent or caregiver. It also focuses on identifying the most important resource for a parent to have in their toolbox. That was language that was given to us by the parents, rather than a comprehensive list. We recognize that there are a lot of very useful directories that are more comprehensive. We do link to those throughout the site, but we heard very clearly from parents that they wanted places to start. And often we prioritize those places to start that had a phone line that somebody could sort of talk through what they were dealing with and get support around what they might need. It features stories of support directly from parents and caregivers. It's parents and caregivers talking to other parents and caregivers, and a diverse group of parents and caregivers in their various roles, normalizing the challenges of parenting and encouraging parents that they're not alone and it's okay to ask for help. And it amplifies this message for all community members. We know that everyone has a role to play in supporting parents and caregivers and children. And so we really want to reflect that message and give opportunities for everyone in the community to think about their role in strengthening and supporting families. And with that, I believe I'm handing it back over to Mariette.
Thank you, Melissa. Well, again, the website will not launch until next week. We did want to take this opportunity to share with you all what it will look like. I will also say those of you who are accessing this website potentially through a maine.gov server may be able to see it right now and get past things. So if you want to navigate it yourself and you have that access, feel free to do so and let us know of any bugs as we test things ahead of the formal launch. Here is a screenshot of what the homepage for BeThereForMe.org will look like. The website is available in English as well as 11 other languages. These languages were identified as the languages most spoken by students in the Maine school system by the MDOE dashboard. You can see on the bottom here, this is how folks will be able to toggle between the different languages, and that box is always present on the navigation as you scroll through both on the website and mobile. I will say I'm sharing screenshots of the web version because they're easier to show on a PowerPoint, but We anticipate most folks will be accessing this site via mobile. We anticipate about 80% of traffic to be mobile traffic to this website, and so have really prioritized that in the design and the development of this website. This is what part of the homepage looks like. We call this the support pages, where we identified with parents and caregivers 10 common support needs, identified here as housing, transportation, getting everyday items, food, childcare, my child's health or development, being a new parent or caregiver, my feelings or stress, my child's feelings or stress, and drugs or alcohol. As Melissa noted earlier, we developed the language for these support pages with parents and caregivers to use the words that they use to speak about their own lives. But we also included, as you'll note, 2 other options here. We start with the I'm not sure where to start. We heard a lot from parents and caregivers about feeling just so overwhelmed that even looking at this list, or maybe you're juggling a need for support across many of these domains, you wanted to know that first place to start. And so have that as the first box that someone can click on. As well as you'll note in the bottom right-hand corner, the something else category. We wanted to really honor that a parent or caregiver might know what they are looking for, but might not see it represented on that list, and wanted to give a place for those folks to go. When you click on one of those boxes, you're brought to what we call a support page. Anna, there's someone in the waiting room too. This is the example of the housing page. One of the biggest challenges that we faced creating this website was limiting the number of supports to just 7 on any of these pages, just recognizing how many supports there are, both at the state and community level for parents and caregivers, but really leaned into this idea of where are the places to go to help someone figure it out. You'll note that we have elevated those to the top of this list, as well as still always linking to that comprehensive directory. I want to know what else is out there, and linking to 211 Maine. The final tab on the homepage of the Be There For Me website is the How to Be There For Me page. This is where the website has a much more general audience. This is the for everyone note, because everyone has a role to play in strengthening and supporting families. And so this page features 9 tips for how to support parents and caregivers in your community, as well as a toolkit of resources that anyone can download to share Be There For Me as a resource. The toolkit includes a flyer, rack card, poster, and social media posts. And the first 3 are available in the same 12 languages that the website is also available in. These materials are available for download directly from BeThereForMe.org, as well as through the Maine Prevention Store for download, as well as requests for printed materials to be sent. So really are hoping that our community partners and state partners will help us get these materials in the hands of parents and caregivers across the state. Did want to share some of these tips that are featured on the How to Be There For Me page. 1, let parents know that you see how hard they are working for themselves and their children. A message of support, a validation of that experience. 2, to check in on your friends and neighbors, ask how they are doing. 3, to share your own story. Think of a time you struggled and needed support. Sharing this can help reduce the stigma of asking for help. 4, ask how you can help. I can't see it under my screen share box there. And be ready to offer options like dropping off a meal or playing with their child while they take a breath. I won't read the rest of these, but did just want to share some of them to really demonstrate that this is leaning into that it's on all of us to strengthen and support families, and a small action can be a really meaningful one to parents and caregivers who may be facing a challenge in their own lives. And building on how to be there, tip number 3, share your own story. We were really fortunate to be able to work with 22 parents and caregivers who have lent their likeness and their stories to this campaign to speak to their peers across the state. Some of these parents are represented on the aforementioned poster, rack card, and flyer that are available for download from the website and by request through the Maine Prevention Store. Really just continuing to emphasize this message that parenting can be a joy, but it can also be hard, and that everyone needs help sometimes, and support is out there. And so we are hoping to really get these materials featuring parents and caregivers out across the state. And again, these are available in 12 languages. So just included here an example of the poster in Arabic, the rack card in French, and the flyer in Portuguese. In addition to those print toolkit materials, we are launching a comprehensive media campaign that includes social media, both organic posting, that's content without paid promotion, and sponsored posts that gives the post priority placement in feeds, as well as streaming TV, online video, digital display, linear TV, radio, gas station TV, and metro bus ads. We hope that these ads reach all of you as people who either may be parents or caregivers yourselves, but also all of you as folks who have a role to play in strengthening and supporting families. As Melissa noted at the beginning of this presentation, this was one-time funding. So with that funding, the initial media promotion will end in October of this year. With the parents and caregivers that participated in this campaign and lent their likeness and stories to our print outreach, we also produced 15 short and long form videos. These are available at the Be There For Me Maine YouTube page now if you're looking for a sneak preview. But I did want to share two of them with you all. I have a short form video example and a long form video example, because as much as we may try to convey this message of support and normalizing challenges, the parents and caregivers really do it best and are really grateful for their participation in this campaign, and that they are the ones sharing a message of support with parents and caregivers across the state. This is now the hardest part of a presentation where you try to share audio, so bear with me. And Melissa, because I can see you, could you give me a thumbs up if it works?
I didn't know how to ask for help, and I've always been the one to feel like, I have to hold everybody together even when I'm falling apart. There is a saying in Nigeria, "Madukeji aka," he who has people is bigger than he who has anything else.
So that is one of the short form video examples. These will be used on social media posts primarily. We also have long form videos as well that will be used for gas station TV, linear TV, as well as social media posts as well. So I will share this. And Melissa, again, give me a thumbs up if it's working. Thank you.
Being a parent is very hard. I wake up in the morning and my feet hit the floor and I'm like, oh God.
You gotta do it when you don't want to do it.
When you have to drive a kid to school when you are sick.
And be a good mom and say all the right things and kiss the boo-boos and make the dinner, and behind that sometimes you're dealing with a lot.
You can't be the only one always.
There is information and support out there that can help the experience of parenting feel better.
Every parent really needs to feel like they can ask for help when they need to.
Being a parent.
Anyway, so just really excited about those videos. I will say that when we previewed those videos with the parents and caregivers who participated in the media days, they had a really emotional response, and some said they really needed to hear it that day because they were having a hard time. And just to be able to say to them, those were your words, you were speaking to yourself, you have that within you, I think was really validating. So again, just wanted to recognize those parents for their courage in sharing their story, because of how much it will mean to other parents and caregivers across the state. Just also wanted to share some example bus ads, again, featuring these parents and caregivers as well, with this simple message of it can be a joy, but also hard to be a parent. And again, here's some examples of the digital display ads. Both the bus ads and these digital display ads all have many versions of them. And so we'll be featuring a rotating cast of folks from the 22 who participated. Commissioner Liberty, I see you have your hand up.
Hello, great presentation. Being a dad of 2 daughters that have children are in the grind right now, and all the pressures that they have that I don't believe I had with childcare costs, and finding that, my daughter, my youngest daughter says that she's supposed to work like she doesn't have children, and she's supposed to parent like she doesn't have a job. and caught right in between. She's also a military spouse. Laura, you know that feeling. And so all of that, and so this is wonderful. Thank you for doing this work. So many parents are really struggling right now. Is there any piece of this, now back to my job, any piece of this that involves incarcerated parents and the particular struggles that they endure? You know, I have 180 women that are incarcerated, and the challenges that they have as often the primary parents. And then, of course, there are some males also that would benefit from this.
Thank you, Commissioner, both for sharing that you see resonance with the folks and the parents and caregivers in your lives, and also for that question. This is a universal campaign and a universal message. So yes, it would hopefully also speak to the women who you work with, but also all parents and caregivers across Maine. But there are, again, because we prioritized having a limited number of places to start for every single page, we wanted to identify those universal doors of entry that can then connect to more specific resources for different populations.
That makes sense. Thank you.
Melissa, do you have anything to add either?
No, I just appreciate the commissioner's question, you know, and just would echo what Mariette shared. Also, just recognizing that, you know, parents face particular and differing hardships and challenges in their roles and in their personal lives. And so always appreciate having the conversation of lifting up particular perspectives and experiences and thinking about how we're particularly reaching out to groups as they're facing different challenges. So appreciate you lifting that up.
Then I have just one last slide before I'll pull things down to see if there are any other questions, but just wanted to say that after we launch on Tuesday of next week, in addition to the paid media promotion and social media, we are doing many presentations like this one and reaching out to all of the state and community partners across the state that we know interact with children and youth and parents and caregivers on a daily basis. And so we really do encourage you to share with us other ways that we can both spread this message of support and destigmatizing the need, destigmatizing asking for help, but also to get these materials in the hands of parents and caregivers. And I will just say that I saw that Hannah Winkelhofer was on the phone, and I'm excited about the Nurture Me conference's theme, also focused on destigmatizing asking for help, and are looking forward to hopefully sharing this with that audience this fall. So I will pull down my screen, and I think we have about 6 or so minutes if anyone has any questions. Julie.
This is so amazing, Mariette and Melissa. I'm so impressed. Will there be a presence at the Maine Educators Summit in early August? And if not, we do have a table that you could have some of your publicity materials.
Thanks, Julie. We don't have plans for that yet, but that would be a great way to connect with folks in school. So I'll follow up with you after this meeting about that. Thank you. Any other questions? Well, just wanted to say again, sorry, Anna, thank you all so much for the opportunity today to share this with all of you. And if anyone has any follow-up or ideas for how to get the word out further, please do not hesitate to be in touch.
And Dr. Carmack, we do have time for your question if you want to ask it.
Oh,
it was just a quick one about this, just to like get to the medical community, because sometimes like people, we don't remember to get to the medical community when we think about community partners. So if Dr. Belisle and I can help you with that, I'm offering her. But she sent out a great email, but like the AAP, the Primary Care Association, the MMA, they get it out to them. And then are there going to be shareable content? You said that, like, how will we have the like online shareable content?
Yes, thank you. And I apologize, Dr. Carmack, your hand raise was hidden under a banner. So thanks, Anna, for that. But I would love to follow up with both you and Dr. Belisle about how to reach the medical community. And the materials The print materials and social media posts are all directly downloadable from the website, in addition to the Maine Prevention Store, but we anticipate most folks will download from the website directly in all 12 languages.
And our plan is to make sure that everyone on this call gets that information as soon as it is all live so they can start sharing with their networks.
Thanks, Anna. I was just going to hop in and say that, like, really all of you are well situated in your professional and networking circles to really help us be ambassadors of this messaging campaign and website. And so we do hope that, we've done a lot of thinking about centers of influence, and we'll be sharing this broadly and widely, and also just would really appreciate any spaces that you're in where you can really give it a personal note and a personal touch to really make sure that, there's a lot of things on folks' radars in terms of the work that they're doing to support families, and any support that you can give us in this to elevate this as an opportunity is really appreciated.
And just before we move on, Anna, I just want to really extend my thanks to Mariette and to Melissa. They've done such great work over the last 18 months, I think, to make this come to fruition. So it's just really, really great to see. And it's so clear that you guys did some authentic stakeholder engagement, and it's really nice to see. So thank you.
Thanks, Commissioner.
Thanks, you guys. And I too want to say I really appreciate all of the input and the stakeholder engagement, and then really showing how that was incorporated into the videos, into the messaging, really helpful for all of us to see of how do you take all this information and input and make it real for folks. And it must be so powerful for the parents to really see that firsthand. So thank you for that. And I will say that's been an ongoing theme of your work as you did that stakeholder engagement and really made sure it fit into the child safety and family well-being plan too. I think you guys are really a model for how we can do that, of incorporating family voice into our work. So thank you for your leadership on that. I want to introduce Mary Karen and Kathy Register, who are here to provide an update and information. We know many of you know about the school telebehavioral health project, some of you don't, and I wanted to make sure, and Commissioner Gagnon-Holmes and I wanted to make sure that folks were aware of this project. It was initially a 2-year pilot, and there has been some funding to keep it going for another year, and it has proven to be a very powerful model in helping to connect students to behavioral health services. So, and it's also been, I think, a nice partnership between Maine CDC and OBH. Mary is a contractor with the Maine CDC in the Adolescent Health and Injury Prevention Division. And then Kathy is a project manager for this project in particular at Children's Behavioral Health Services in OBH. So I'm going to turn it over to them. I'm actually not sure who's presenting, so both of you have the ability to share your screens. So I'll turn it over to you guys.
Thank you. I think Kathy's going to start us off, but I'm going to share my screen. So let me get that sorted here.
While Mary's doing that, let me give you guys a little bit of background. I see some familiar faces. I know some of you are very, very familiar with this project. About a year or so into the pandemic, we learned that there was a school telebehavioral health service project happening in Northwestern Massachusetts, and it was being offered by Haywood Health Services, healthcare services in very rural areas, not unlike our situation here in Maine. They were offering telecounseling services to adolescents, basically, and having great success with their programs. And the key component to their service that really makes this project work is the addition of a school community health worker. The school community health worker is embedded in the actual school, excuse me, does a lot of the scheduling, communicates with parents. She or he is really like a school staff. That's a real crucial piece of the success of the program. If you can imagine having a bunch of middle schoolers and high schoolers sitting in a class in a small office, staring at a computer, trying to engage with a therapist, we were surprised that people were having success with this, but it really is going well. Mary will get more into the presentation, more into the role of the CHW as into the PowerPoint, but I wanted to just suffice it to say that without that CHW being embedded in the school, we're not sure that this program could really work. But if I'll let Mary pick up the PowerPoint. If you guys have any questions, hopefully there will be time at the end of the project here. Thank you.
Awesome. Thanks, Kathy, for kind of kicking us off there. Hopefully I'm sharing the right screen. Can you give me a thumbs up, Kathy, if it is? Okay, perfect. And I know some of you have heard about this project. I was under the understanding that some haven't. So we're going to kind of go through some of our initial data from our first year of the pilot. And we're really excited about what this has shown. And we've continued to collect data into year 2. And unfortunately, well, not unfortunately, we're in the process of validating the year 2 data currently, so we aren't able to integrate that into this presentation yet, though it is coming, and we're looking to expand now that we have this 3rd year to really dig into some more outcome data and getting student input on this program and feedback on this program. So as Kathy said, I'm going to cover some of our evaluation data from that first year of this program, and that included some surveys, interviews, focus groups, and then program data as well. And kind of throughout, you'll just see some quotes that we've woven into the slides, so feel free to read those. I'll highlight a couple of them, but I think those are really important and to me very powerful because I think they really tell the story of the work in a way beyond some of the data even. So in that first year of the program, which ran from September of 2022 to June 2023, there were 6 rural schools who participated in the project with our 3 behavioral health agencies who contracted and employ the community health workers and the behavioral health clinicians for the telehealth program. But as Kathy said, that community health worker is central to this program and is embedded in the school, which is the really unique component. And we'll dig into that a little bit more in a moment. But there were 94 students enrolled and approximately 5 behavioral health sessions occurred per student in that first year. All right. On kind of the program data end thing, I think it helps to just set the stage in terms of why young people were being referred into this program. So there were a variety of reasons. The most common was anxiety and social and emotional problems, and then there were behavioral issues and depression are kind of rounded out the top few there. But from our program perspective, I manage a suicide prevention grant, so certainly suicidal ideation and students who may be experiencing crisis being another reason for referral and getting access to services through this program. So as Kathy said, we wanted to, in this initial evaluation, where we had just 1 year of funding at the start, to really look at the community health worker role and what they were adding and what they were bringing to this program that was unique and beyond what a regular telebehavioral health program could offer in a school. And so next, I'm going to kind of dig into looking at how they were integrated into the work, as this has been a challenge that's noted in some of the literature in utilizing community health workers. And what we found was that those CHWs, I'm going to use that acronym moving forward here for community health workers, from the clinician perspective, they were fully integrated into the care team and they became a real team. And I think this quote at the top here kind of demonstrates that. And I really like how this clinician shared that the community health worker creates a welcoming and safe space, and that her relationship with the student is just an extension of my relationship with them, and wanting them to see them as a team. So they're one and the same, one is in person and they can stop in throughout the day, whereas the clinician's time might only be a 1 hour slot a week. And so I think we were happy to see that teamwork and that connection between the community health worker and the clinician. And from the perspective of the interviews and focus groups, we found that those community health workers were really a beneficial conduit to share information and connect the school, the parents, and the clinician, and helped really lighten the workload of others so that they could focus more on their role and their work. And I think it's also interesting of seeing them as a care extender and being able to offer a different perspective on the student. You know, they're another safe adult in the school for students to go to, and students, you know, may not want to go to a school administrator or a teacher. And as the clinician noted in that quote, you know, they only have a 1 hour time slot with the clinician maybe in a week. So having that person who's available and there to just kind of check in and provide support and can connect to the clinician as needed is really beneficial and a unique part of this program. The other thing we've seen with this program, and that's highlighted in that earlier slide where it kind of laid out the 1, 2, 3, 4, 5 and kind of the steps, is that the community health workers can connect to community resources and have. One CHW opened a clothing closet to provide students with gently used clothing, and others have collaborated with food pantries to send students home with a bag of food when they need it. So I think those are unique ways to kind of help fill in some of the additional needs that a CHW can do that's beyond kind of that clinical focus and what the clinician is able to do. And I don't mean to present all of that and act like there were no challenges whatsoever. We certainly experienced and saw some of those in that getting that community health worker. This was a pilot program initially, getting them established and having folks understand what their role was and that they could engage with them and kind of who they were was certainly a challenge at the start, but we were fortunate to have a lot of awesome behavioral health agencies and staff working in those roles to be able to kind of overcome those challenges, you know, meeting with school leadership and using them to help connect to and engage parents until they got to know who that community health worker was, and just being able to hold regular meetings with broader school staff to help with getting referrals. Pieces like that certainly helped with integrating that CHW into the role and getting these programs up and running in schools. So as I said, we also did a few surveys and focus groups as a part of this work. So one thing that we asked about was satisfaction with the program from school staff and parents and caregivers. And what we found from school staff was overwhelmingly school staff recommended the program, 100% strongly agreed or agreed that they would recommend this program to other schools. And that they understood why this program was being implemented, services offered were clear. And I think it's great to see that over 75% strongly agreed or agreed that it was an efficient and easy referral process, which in getting a new program off the ground to have that level of agreement, I think is great and is a testament to all of the awesome work that's been done. And on just a really specific note, we've had one school district in particular in Pittsfield who has been so incredibly engaged in this work. They've actually presented at several statewide conferences with us, and we've hosted a webinar where several of their staff came and presented and shared and talked about this work. So it's been incredible to see the buy-in from them. Similarly, we asked parents about their satisfaction with the program. And again, 100% said that they would recommend the program to other schools, and just overall very satisfied, certainly with the support that they received, the program itself, and the communication. And just a note on this chart where it doesn't add up to 100 just means that it was neutral or not applicable that was selected. So there's actually no one that said they were dissatisfied, which is great, at least initially here. So in the first year of the pilot, we asked clinicians, school staff, and parents also if they thought students were positive about the program. And because this was only a 1-year pilot initially, we didn't really have the capacity to get students involved and get that through IRB to be able to like pull a full evaluation together. But we're really excited to actually be working with the IRB Institutional Review Board now, as we plan to do some student surveys in the coming year to kind of better integrate those student voice and input into these findings. But what we did find in the first year was from the perspective of clinicians, school staff, and parents, they most of them strongly agreed that students were positive about the program. And I think this quote here is a really good example of having a young lady who was always in trouble, known for vulgarity, shouting down teachers, and just being an issue. And then when it came time for her session, she would just appear, and how that speaks volumes to me. And I believe this was a school staff member about the work that the clinician was doing. All right, and so I just have a couple slides to wrap up here on some of the program impact pieces that we looked at and we're really interested in the initial year of this programming. So one thing that is kind of a benefit to telehealth, and that's really important in telehealth, is increasing access. And that's why the focus was really in rural schools. And so we asked clinicians and parents if they would strongly agree or agree with a variety of statements relating to reduced travel time, reduced costs to client and family, reduced stress. And then clinicians also rated that the program strongly agreed that it reduced the number of missed and rescheduled appointments. And so it makes a lot of sense, right? And I think this parent on the right here, this quote kind of puts it all together in terms of why, right? This parent doesn't have to go take the student out of school to rush over to an in-person session or take time off of work to accommodate the student getting the help that she needed. So we were excited to see pretty strong agreement overall in that this program was able to increase access through those methods by reducing those barriers that often come with accessing services. And then we also had clinicians, parents and guardians, and school staff rate whether students had, quote, improved a lot since taking part in the program on a variety of outcomes we were interested in. I've only highlighted 4 here just because if I was to highlight all of them, it would be way too much for a slideshow presentation. But we picked these ones in particular because relationships and connection are so important to mental health promotion and suicide prevention efforts. And we want young people to have solid relationships and have these developed for when they do need help so that they know where to go and that they know they have support. And overall, we saw some really great response from folks that students were improving. I really like to look at and point out the fact that almost 75% of the parents who responded to our survey said that the student had improved a lot in their relationship with them. Which I think is really, really telling, especially considering that's the highest percentage of parents saying students had improved a lot. And it was so much higher than the clinicians or school staff's perspective. And so certainly some positive initial outcomes that we're seeing there. And as I noted, moving into this year 3, we're going to look to expand some of the outcome data collection that we're doing and dig into some of this a bit more. So we're really looking forward to that. All right, and then I know we're probably getting near the end of time here. So just to wrap it all up, we're really happy with how that first year and now even going into just finishing this second year have gone. And we've tried to take a lot of these lessons learned from this evaluation to help share the findings, and we hope we can help this program grow. Saw some great outcomes in terms of increased access. And there were certainly some challenges, and we know that telehealth isn't for everyone. And getting technology to cooperate can be a challenge. But the community health workers and program staff on this program did an awesome job in navigating all of this to be able to provide services to those 94 students. And I should also note one other challenge that's been significant throughout this would just be staffing. And I think that's an ongoing challenge in most of the behavioral health workforce, just with labor shortages and workforce competition in rural areas. But again, we've been working with folks to get fully staffed up, and we're really happy about where this has gone. So we plan to continue, as I said, collecting this data moving into the coming year, looking at those additional outcomes, and sharing these findings through the end of our funding, which will be done on June 30th of next year. So we're moving into that last year where we have funding here. But I will stop to leave time for any of your questions or thoughts, and thanks for the time.
And before I just want to add that funding wise, we did get grant money for years 1 and year 2, and year 3 we've got substantially less grant money, but originally the program was to be self-funding in perpetuity based on how much money and insurance reimbursements that the clinician could claim. And I just wanted to give you a round. In year 2, our 3 agencies collected about $204,000 from Maine Care and private insurance. So those numbers have increased substantially since year 1. We're expecting even more for year 3. So hopefully this is a program that will be successful on its own, will not need department funding down the road, or not substantial funding. Thank you. Does anybody have any questions that we can answer in 2 minutes?
Mary, could you bring, there you go. Great. Any questions? We have about 2 minutes. So if there's one question from folks. Well, Mary and Kathy, go ahead. Go ahead.
Sorry, can't find my hand, my electronic hand. Really quickly, one of the challenges I saw was parent engagement. And I just wondered, although it was a challenge, do you have any lessons learned for how that can be improved moving forward? I think that could be beneficial for a number of different programs. So I'd love to hear that.
Yeah, I think the biggest thing that helped with getting parents involved in the program was using the schools as the initial connectors to parents, because parents were used to hearing from schools and knew the school, whether it was phone number or person who was calling them. So if the school was presenting it as this is a program that, is going to be easy for you, low lift, your student's going to be in school, we can pull them out of, I think it was usually like, non-core class times and things is what the classes that they'll come out of for sessions. But that was the biggest thing in terms of getting parents on board. And then the community health worker, once they developed the relationship with the parent, was able to kind of boost from there. But I think cold calling parents is not easy, certainly.
And I think what we tried to do also was to hire a community health worker who was from their community. So in most of the cases, they knew the services, they knew some of the people, they knew some of the schools. So that helped a lot as well.
Great. Thank you for that.
Of course.
Thank you guys, and perfect timing. We are on time. And thanks everyone for participating in the call. Lots of great information. We'll be sure to get all of this information out to folks as well, so that folks have it. And I'm going to share, we actually recorded this video, and so we'll be able to share it with folks who were not able to be here either. And we meet again as a Children's Cabinet on September 17th. And the Children's Cabinet staff will be hard at work between now and September 17th, continuing to work on all of our initiatives. And thanks everyone. Hope everyone stays cool for the rest of the day. Bye.
Thank you.